As we age, maintaining good health becomes increasingly dependent on the choices we make, especially when it comes to our diet. While nuts are often praised for their health benefits, not all nuts are suitable for everyone, particularly older adults. A recent video sheds light on this issue, emphasizing that while nuts can be a great source of protein, healthy fats, and antioxidants, some varieties may pose unexpected health risks for seniors. The video particularly focuses on 4 types of nuts that could potentially harm elderly individuals if consumed in large amounts or without awareness of their effects: peanuts, cashews, macadamia nuts, and pine nuts. Each of these nuts comes with specific concerns related to digestion, inflammation, weight management, or allergic reactions, factors that become more critical as the body ages. The first nut highlighted is the peanut, which, despite its popularity, can cause significant problems in older individuals. Technically a legume, peanuts are often roasted and salted, increasing their sodium content, which can be harmful for seniors with high blood pressure or heart disease. Additionally, peanuts are among the most common food allergens, and even for those not allergic, they can be hard to digest, especially if the digestive system has weakened over time. A more serious concern lies in the potential contamination of peanuts with aflatoxins, toxins produced by mold that grows on improperly stored peanuts. These aflatoxins are known to be carcinogenic and can compromise liver function, which is particularly dangerous for the elderly, whose liver may already be under strain from medications or age-related decline. Therefore, while peanuts may offer protein and some healthy fats, their potential risks in older adults often outweigh their benefits. Cashews are another nut that can be problematic for seniors, primarily due to their high oxalate content. Oxalates can contribute to kidney stone formation, which is already a concern for many older adults with reduced kidney function or a history of urinary tract issues. Cashews are also calorie-dense and high in carbohydrates compared to other nuts, which can make weight control more difficult for those with a slower metabolism. Weight gain in older age not only puts additional pressure on joints and the cardiovascular system but can also worsen conditions like type 2 diabetes. Moreover, cashews, when salted or coated with flavorings, can deliver an excessive amount of sodium, leading to fluid retention and elevated blood pressure. Despite being rich in minerals like magnesium and zinc, cashews should be consumed in moderation and preferably unsalted, especially for seniors watching their heart health or kidney function. Next on the list are macadamia nuts, known for their buttery texture and rich flavor. While they are a good source of monounsaturated fats, macadamia nuts are extremely high in calories and fat, which may be problematic for older individuals with sedentary lifestyles. Overconsumption can lead to unintended weight gain and sluggish digestion. Furthermore, macadamia nuts contain a type of fat that, although not inherently harmful, may not be ideal for seniors with pre-existing lipid disorders or gallbladder issues. They also tend to be among the more expensive nuts, which might encourage people to buy them in bulk and consume them over time, potentially leading to stale or rancid nuts, which are not only unpalatable but can cause digestive distress. In elderly individuals with a slower metabolism and decreased digestive enzyme production, these rich nuts can lead to bloating, discomfort, or even exacerbate issues like acid reflux. Lastly, the video discusses pine nuts, which are less commonly consumed but still popular in dishes like pesto. Pine nuts can trigger a rare condition known as pine mouth or pine nut syndrome, where individuals experience a bitter or metallic taste in their mouth that can last for days or even weeks. While not dangerous in a toxicological sense, this reaction can affect appetite and enjoyment of food, which is concerning for elderly individuals who may already struggle with diminished taste sensation or poor appetite. Additionally, pine nuts are another calorie-dense food that can lead to excessive caloric intake if portion sizes are not carefully controlled. They also contain omega-6 fatty acids, which in large amounts can contribute to inflammation, something many seniors already struggle with due to arthritis or other inflammatory conditions. 1. Peanuts, hidden risks for seniors. Peanuts, while widely consumed and affordable, pose several risks for older adults. Though technically legumes, they are nutritionally categorized with nuts and are rich in protein, fiber, and healthy fats. However, they also carry a number of health concerns that are especially relevant in later years. One major issue is aflatoxin contamination, a toxic substance produced by a mold, Aspergillus flavus, that can grow on peanuts during storage, especially in warm and humid climates. Aflatoxins are known to be carcinogenic and may harm liver function, a serious concern for seniors already managing medications that stress the liver. Peanuts are also one of the most common food allergens, and while many allergic individuals are aware from a young age, sensitivity can also develop later in life. Even for non-allergic individuals, peanuts can be hard to digest, particularly when roasted or consumed in large amounts. Seniors often experience slower digestion and a reduction in stomach acid, making the body less efficient at breaking down complex foods. Another concern is the high sodium content in many commercially available peanut products. Salted or flavored peanuts can lead to elevated blood pressure, fluid retention, and increased strain on the heart, especially dangerous for older individuals with cardiovascular issues. While unsalted and dry roasted varieties are a better option, they should still be consumed in moderation. Finally, peanuts are high in calories, and excessive intake can lead to weight gain, which increases the risk of joint problems, diabetes, and heart disease in older adults. Though they offer some nutritional benefits, the risks associated with contamination, allergies, and sodium make peanuts a food that seniors should consume cautiously and only in small portions. 2. Cashews, kidney and weight challenges. Cashews are a popular snack due to their creamy texture and slightly sweet flavor, but they carry several risks that can be especially problematic for older adults. Although they are often labeled as heart-healthy nuts due to their magnesium and unsaturated fat content, they must be approached with caution by seniors. One of the biggest concerns is the high oxalate content in cashews. Oxalates are naturally occurring compounds that can bind to calcium and form kidney stones, a painful condition that becomes more common with age. For seniors who already have reduced kidney function or are prone to urinary tract problems, consuming large quantities of cashews can increase their risk significantly. Cashews are also relatively high in carbohydrates compared to other nuts. While carbs are a necessary energy source, cashews can raise blood sugar levels if not balanced with fiber and protein. For seniors managing diabetes or prediabetes, this can be problematic. In addition, their high calorie density means that even small servings can contribute to weight gain, which can worsen mobility issues, joint pain, and cardiovascular risks. Moreover, many commercial cashew products are salted or flavored, significantly increasing their sodium content. High sodium intake contributes to hypertension and can lead to fluid retention, increasing the burden on aging hearts and kidneys. Flavored cashews may also contain additives and preservatives that some older adults may be sensitive to. On a positive note, raw or dry roasted unsalted cashews do contain beneficial nutrients like copper, magnesium, and zinc, which support immune function and bone health. However, due to the risk of oxalate buildup and potential for overconsumption due to their addictive taste, cashews are best enjoyed in moderation and with awareness of existing health conditions. 3. Macadamia nuts, a calorie-dense danger. Macadamia nuts are often considered a gourmet delicacy, admired for their rich, buttery flavor and creamy texture. While they do offer heart-healthy monounsaturated fats and essential nutrients like manganese and thiamine, they may not be the best choice for seniors, especially when consumed regularly or in large quantities. One of the most concerning factors is their extremely high fat and calorie content. A small handful, about 10 to 12 nuts, can easily contain over 200 calories and 20 grams of fat. For older adults with a slower metabolism and reduced physical activity, this can contribute to unwanted weight gain. Increased body fat in seniors is associated with a higher risk of insulin resistance, cardiovascular disease, and joint stress. Although the fats in macadamia nuts are primarily monounsaturated and considered heart-healthy, their low protein and fiber content means they're not very filling despite being calorie-dense. This can lead to overconsumption, especially since their mild taste makes them easy to snack on mindlessly. Seniors trying to manage their weight or control blood sugar levels should be particularly cautious. Digestively, macadamia nuts can be hard to process, especially for individuals with gallbladder issues or compromised digestive enzyme production. This can result in bloating, gas, or acid reflux. In some cases, seniors may even experience loose stools or discomfort after eating fatty nuts like macadamias. Storage is another concern. Because of their high fat content, macadamia nuts can go rancid quickly if not stored properly, leading to unpleasant taste and digestive upset. Older individuals with diminished sense of taste or smell might not notice when nuts have spoiled. While occasional consumption of a few macadamia nuts can be part of a balanced diet, they are best viewed as a treat rather than a staple, especially for seniors focused on maintaining weight, digestion, and metabolic health. 4. Pine nuts, the hidden side effects. Pine nuts are small, teardrop-shaped seeds harvested from pine cones, and they are often featured in gourmet dishes, particularly in Mediterranean cuisine. While they are rich in nutrients such as vitamin E, magnesium, and monounsaturated fats, pine nuts also come with several drawbacks that can negatively affect elderly individuals. Perhaps the most unusual concern is a condition called pine mouth or pine nut syndrome. After consuming certain varieties of pine nuts, individuals may develop a bitter or metallic taste in their mouth, often lasting for several days to over a week. While the exact cause of this condition isn't fully understood, it is believed to be linked to specific species of pine nuts and how they're processed. Although pine mouth is not dangerous in a medical sense, it can significantly affect appetite, which is problematic for seniors who may already struggle with reduced hunger or enjoyment of food due to age-related changes in taste perception. In addition, pine nuts are another calorie-dense food, packing over 190 calories and nearly 20 grams of fat per ounce. Their small size can make it easy to overeat them without realizing it. For seniors dealing with weight management or metabolic conditions like diabetes, excessive intake can contribute to increased blood sugar, cholesterol, or triglyceride levels. Pine nuts also contain a relatively high amount of omega-6 fatty acids, which in large quantities can contribute to inflammation if not balanced with omega-3s. For elderly individuals with arthritis, cardiovascular disease, or autoimmune conditions, this can potentially worsen existing symptoms. While pine nuts do have beneficial nutrients and can enhance meals like salads and pasta, they should be used sparingly and with awareness of potential side effects. Seniors should opt for small amounts, preferably toasted and stored well to avoid rancidity. Pine nuts. Small seeds, big considerations. Pine nuts may be small, but their impact on senior health can be surprisingly complex. These seeds, often used in pesto and gourmet dishes, contain certain natural compounds that may interfere with medications, including blood thinners, cholesterol drugs, and appetite-related prescriptions. For older adults on multiple medications, even small dietary additions like pine nuts can have unintended effects, making it important to consult a healthcare provider before incorporating them regularly. Another well-documented side effect is pine mouth, a condition that causes a bitter or metallic taste to linger in the mouth, sometimes for several days. This phenomenon, though not harmful, can drastically reduce appetite and enjoyment of food. For seniors already coping with diminished taste sensitivity or poor appetite, this can further decrease nutritional intake, leading to unintended weight loss or malnutrition. Interestingly, some studies associate pine nut consumption with reduced body weight, likely due to their impact on satiety hormones. However, for older adults who are underweight or struggling to maintain their energy needs, this effect may be more of a risk than a benefit. In short, while pine nuts offer healthy fats and minerals, their interactions with medications and impact on taste and weight require caution, especially for seniors. Analogy. Dietary choices as roadmaps. Making dietary choices is like navigating a complex roadmap. Just as a driver needs to select the safest and most efficient route to reach their destination, a senior must carefully choose foods that nourish the body while avoiding those that may cause detours, like inflammation, digestive distress, or medication interactions. Imagine a road filled with traffic jams, potholes, or dead ends. That's what it's like when seniors unknowingly consume foods that worsen existing health problems. For example, too much sodium can raise blood pressure, like a roadblock, and calorie-dense nuts can lead to weight gain, like a detour that wastes fuel. Conversely, choosing nutrient-rich, senior-friendly foods is like cruising down a well-paved highway with clear signs and smooth traffic. It supports strong bones, heart health, and brain function, ensuring that the body, remains functional and resilient. Every snack, meal, or ingredient is a turn on the journey to well-being. Seniors need to learn how to read the nutritional map, avoid risky paths, and stay on the healthiest route. Smart, informed eating doesn't just help them reach the destination of longevity, it makes the journey comfortable and fulfilling, too. Peanuts. More than just a snack. Peanuts are one of the most popular snacks worldwide, but for seniors, they come with important caveats. While rich in protein, folate, and healthy fats, peanuts are also high in calories and omega-6 fatty acids, which, in excess, can lead to chronic inflammation, a major contributor to arthritis, heart disease, and cognitive decline in aging populations. Another serious concern is aflatoxin contamination. Aflatoxins are toxic compounds produced by mold that can develop in poorly stored peanuts. These toxins are known to harm the liver and may increase cancer risk, especially dangerous for elderly individuals whose liver function may already be compromised by medication or aging. Moreover, peanut allergies are among the most severe and can sometimes develop later in life. Even non-allergic seniors may experience digestive issues when consuming roasted or salted peanuts, especially those with gastrointestinal sensitivities. Peanuts may also interact with blood thinners like warfarin. The vitamin K content in peanuts can affect how warfarin works, potentially altering blood clotting times. This makes it crucial for seniors on anticoagulant therapy to regulate their peanut intake and consult their physician regularly. While peanuts offer some nutritional value, older adults should be cautious and prioritize moderation and quality, such as choosing unsalted, dry roasted peanuts over salted or flavored versions. Light bulb omega-6 fatty acids. Balance is key. Omega-6 fatty acids are essential polyunsaturated fats that support cell growth, hormone production, and brain function. However, excessive consumption, especially without balancing omega-3 intake, can lead to harmful inflammation, contributing to arthritis, heart disease, and other chronic conditions that affect seniors disproportionately. Modern diets often include too much omega-6 due to widespread use of vegetable oils, processed snacks, and certain nuts like peanuts and pine nuts. While omega-6 itself isn't inherently bad, the ideal ratio between omega-6 and omega-3 should be around 4:1 or lower. Unfortunately, many people consume these fats in ratios closer to 15:1 or even 20:1, which fuels inflammation in the body. For seniors already dealing with inflammatory issues, such as joint stiffness, autoimmune disorders, or vascular problems, an overload of omega-6 can exacerbate symptoms and reduce quality of life. This imbalance may also affect cognitive health, as chronic inflammation has been linked to neurodegenerative diseases like Alzheimer's. To manage this, seniors should reduce intake of omega-6 rich foods, such as corn oil, soy oil, and some nuts, and increase omega-3 intake through foods like flax seeds, walnuts, and fatty fish. Achieving the right balance helps maintain joint health, brain clarity, and cardiovascular wellness, crucial for aging gracefully. In conclusion, while nuts are generally a healthy snack, not all nuts are created equal, especially for seniors. The video serves as a cautionary guide, urging older adults and their caregivers to make informed dietary decisions based on individual health needs and risks. Rather than eliminating nuts entirely, the focus should be on moderation and choosing the right types, such as almonds, walnuts, and pistachios, which offer significant health benefits without the concerning drawbacks highlighted. As always, consulting a healthcare provider or dietitian before making significant dietary changes is essential, especially when managing chronic health conditions. Ultimately, with smart choices, seniors can enjoy the nutritional benefits of nuts while minimizing potential health risks. If you liked this video, like, share and subscribe.